In the world of modern medicine, routine tests are often seen as the cornerstone of preventive care. From simple blood draws to advanced imaging scans, these procedures are designed to catch health issues early, sometimes even before symptoms appear. The logic is straightforward. The earlier a problem is detected, the better the chances of successful treatment or even prevention. For decades, this approach has been widely accepted and promoted by healthcare professionals and public health campaigns alike. Routine testing has become so ingrained in our healthcare system that many people rarely question its necessity or safety. Annual checkups, complete with a battery of tests, are considered a responsible part of self-care, especially as we age. For many, these tests offer peace of mind, reassurance, and a sense of control over their health. But what if some of these routine procedures, rather than protecting us, could actually put us at risk? A recent study has sent shockwaves through the medical community, challenging long-held assumptions about the safety of one of the most common and seemingly harmless medical tests. The findings suggest that this routine procedure may actually increase the risk of stroke, sometimes within just hours or days of the test. This revelation has prompted urgent calls for further research, a re-evaluation of current medical guidelines, and a renewed focus on the risks as well as the benefits of preventive screening. The test in question, carotid artery ultrasound. At the center of this controversy is the carotid artery ultrasound. This non-invasive test uses high-frequency sound waves to create detailed images of the carotid arteries, which run along both sides of the neck and supply blood to the brain. The test is painless, requires no needles or incisions, and is typically completed in less than 30 minutes. It has become a routine part of care for older adults and those with risk factors for stroke, such as high blood pressure, diabetes, high cholesterol, or a family history of cardiovascular disease. For years, carotid ultrasound has been considered a safe and effective way to detect blockages or narrowing, known as stenosis, in the carotid arteries. Identifying these problems early can help prevent strokes, which are a leading cause of disability and death worldwide. As a result, millions of people undergo this test every year, often as part of a regular checkup, or after experiencing symptoms like dizziness or transient vision loss. The test is so common that it is often included in community health fairs and mobile screening events, sometimes offered to people with no symptoms at all. The prevailing wisdom has been that more information is always better, and that early detection is the key to better outcomes. But, as this new research shows, the reality may be more complicated. The shocking discovery. This sense of security was upended by a groundbreaking study, published in the Journal of Vascular Medicine in June 2024. Researchers at the University of New Haven conducted a large-scale analysis of more than 50,000 patients who underwent carotid artery ultrasound between 2018 and 2023. Their findings were both unexpected and alarming. Within 48 hours of the test, there was a significant spike in the incidence of ischemic strokes, the most common type of stroke, caused by a blockage in the blood vessels supplying the brain. The numbers were striking. Patients who had a carotid ultrasound were found to be 2.3 times more likely to experience a stroke within 2 days of the procedure, compared to a matched group of patients who did not undergo the test. The risk was even higher among those with pre-existing carotid artery disease, suggesting that the test may be particularly hazardous for individuals who are already at increased risk. The study's authors were careful to control for a wide range of factors, including age, sex, medical history, and known stroke risk factors. Even after these adjustments, the association between the test and increased stroke risk remained robust. The findings were so unexpected that they have prompted calls for immediate review of current screening practices and guidelines. How could a simple test cause harm? At first glance, it seems almost inconceivable that a non-invasive, painless test could trigger such a serious event. Yet, the researchers propose several plausible mechanisms that could explain the increased risk. 1. Plaque dislodgement. The ultrasound probe, when pressed against the neck, may inadvertently dislodge unstable plaques within the carotid artery. These plaques, made up of fatty deposits and other materials, can then travel to the brain and cause a blockage, resulting in a stroke. 2. Hemodynamic changes. The test often requires patients to turn their heads or hold certain positions, which can temporarily alter blood flow dynamics in the neck. In individuals with already compromised arteries, these changes might be enough to precipitate a stroke. 3. Inflammatory response. Some evidence suggests that the ultrasound waves themselves, though low in energy, could trigger a localized inflammatory response in the arterial wall. This inflammation may make existing plaques more likely to rupture. 4. False sense of security. In some cases, a normal ultrasound result may lead patients or doctors to underestimate the risk of stroke, potentially delaying necessary interventions or lifestyle changes. While these mechanisms are still being studied, the possibility that a routine test could have such unintended consequences is a sobering reminder of the complexity of the human body and the need for caution, even with procedures that seem entirely safe. Expert reactions. The medical community's response to these findings has been swift and, at times, divided. Dr. Linda Chen, a vascular neurologist at the Mayo Clinic, described the results as deeply concerning, noting that we have long assumed carotid ultrasound to be entirely benign. This study forces us to reconsider that assumption, especially in high-risk patients. Others, however, urge caution in interpreting the results. Dr. Michael Patel, a radiologist at Johns Hopkins, points out that correlation does not equal causation. It's possible that patients who are already at imminent risk of stroke are more likely to be sent for an ultrasound, which could skew the data. In other words, the test itself may not be causing the strokes. Rather, the patients who need the test may already be on the verge of having a stroke. Nevertheless, the study's authors took pains to control for such confounding factors, matching patients by age, sex, medical history, and stroke risk profile. Even after these adjustments, the association between the test and increased stroke risk remained robust. The debate has spilled over into medical conferences, online forums, and even mainstream media, as doctors and patients alike grapple with the implications. Some experts have called for immediate changes to screening guidelines, while others advocate for a more measured response, emphasizing the need for further research. Implications for patients. For the millions of people who undergo carotid artery ultrasound each year, the study's findings are understandably alarming. Should you cancel your upcoming test? Should you be worried if you recently had one? The answer, according to experts, is not so simple. Who should be concerned? The increased risk appears to be most pronounced in patients with known or suspected carotid artery disease, those who already have significant narrowing or unstable plaques. For these individuals, the potential for plaque dislodgement is highest, and the test may carry greater risk. For patients with no symptoms and low risk, the absolute risk remains small. However, the study raises important questions about the widespread use of carotid ultrasound as a screening tool in asymptomatic individuals. It suggests that the test should not be used indiscriminately, but rather reserved for those who truly need it. What should you do? If you are scheduled for a carotid artery ultrasound, consider discussing the risks and benefits with your healthcare provider. Ask whether the test is truly necessary in your case, and whether alternative methods of risk assessment might be appropriate. For those who have already undergone the test, the risk of stroke remains low, but it's important to be vigilant for warning signs in the days following the procedure. These include sudden weakness or numbness on one side of the body, difficulty speaking, vision changes, or severe headache. If you experience any of these symptoms, seek medical attention immediately. It's also important to remember that the vast majority of people who undergo carotid ultrasound do not experience any complications. The test remains a valuable tool for diagnosing serious conditions in the right patients. The key is to use it judiciously, balancing the potential benefits against the newly recognized risks. Calls for change. In light of these findings, several professional organizations are re-examining their guidelines. The American Heart Association has convened an emergency panel to review the evidence and issue updated recommendations. Some experts advocate for stricter criteria for ordering carotid ultrasounds, reserving the test for patients with clear symptoms or high-risk profiles. Others suggest modifications to the procedure itself, such as using less pressure with the probe, avoiding certain head positions, or developing new protocols to minimize risk. There is also a growing call for better patient education. Many people consent to tests without fully understanding the potential risks and benefits. As this study shows, even routine procedures can have unexpected consequences. Patients should be encouraged to ask questions, seek second opinions, and make informed decisions about their care. The revelation that a simple, routine medical test could spike the risk of stroke overnight is a sobering reminder of the complexities of modern medicine. While carotid artery ultrasound remains a valuable tool in the fight against stroke, this new evidence highlights the importance of ongoing research, critical thinking, and personalized care. As the medical community grapples with these findings, one thing is clear: when it comes to your health, there are no one-size-fits-all answers. Stay informed, ask questions, and work with your healthcare team to make the best decisions for your unique situation. In the ever-evolving landscape of medicine, vigilance, open communication, and a willingness to adapt are essential for ensuring the best possible outcomes for every patient. Ultimately, this study serves as a powerful reminder that even the most routine aspects of healthcare deserve careful scrutiny. As we continue to learn more about the risks and benefits of medical testing, both patients and providers must remain engaged, informed, and proactive. Only by working together can we ensure that preventive care truly lives up to its promise, protecting health, preventing harm, and empowering individuals to make the best choices for their lives.